Hey everybody, Dr. Greg here again from the E-Center for Hope and Vision. That's echv.org. And today we're talking about what is low vision rehabilitation. You know, many people will call when they have low vision to schedule an appointment, but then they ask, what do I need another eye exam for when I just had one? Well, the truth is that this is really a different form of an exam. While there will be many components that are very similar, there are many things that are actually different in a low vision exam that you won't find at a regular doctor's office. When you come into our office or when we take information, we start with an intake, very much like a case history that you'll see at your regular primary care provider's office. But we will talk about a lot of different things, especially surrounding the eyesight. What are the things that a person has lost the ability to do because of the particular vision degeneration that they are wrestling with. It may be macular degeneration, glaucoma, diabetic retinopathy, cone rod dystrophy, Stargardt's, optic neuritis or optic atrophy. There's so many different disease processes or injuries or trauma that can cause vision loss. The point is, what is it that they have lost the ability to do? And what have they tried to do? What are the things that they've tried? What are the fix-its that they've come to know? What are the workarounds that they have? And what types of devices do they have? And have they used, and what have they not been successful with? Those are very good things for us to know as we begin our exam. We will start by taking visual acuity, just like we do with any other exam. And I think it's important for people to understand how to use their vision. So we'll teach people oftentimes, if they have a blind spot right in the center of their vision, we teach them how to use the vision that is around that blind spot, and that's called using eccentric viewing. We teach a person how to find that spot inside of their eye, which is the best spot that they can use to see. We refer to that as the PRL, or the preferred retinal locus. Those are fancy terms to say, where's the sweet spot? And I want people to understand how to do that in each eye and then with both eyes together, so that if their vision were to change moving forward, they would know again how to make that modification, how to find that new best spot, which would become over time their new center of vision, and then be able to use that successfully to navigate or to complete their activities of daily living, the type of things that they want to be able to do or need to do. From there, after measuring their acuity, that will help us to understand where they're at with their particular glasses or contact lenses that they have right now. I will recheck a person's prescription, as all low vision practitioners will be doing, and not because we don't trust the other doctors, and we do, but the point is we need to make sure that we're getting every ounce of vision out of that person that we can possibly get for them, so that we can help them be able to accomplish their tasks. To do that, we do a very extended refraction, not the type that you'll see with the phoropter, you know, that big instrument that you have, and the doctors will spin the lenses, which is better 1 or 2, 3 or 4. And that's one of my favorite instruments. It's called a phoropter, but we don't use that because the aperture is actually too small when we need to teach people to look off one side or the other. We will do what's called a trial frame refraction, which is very much what most people consider the old way, and we will put a pair of glasses on, and we will put lenses in one at a time, and we will discern which is really the best prescription for that person on each eye so that we can get them the maximum vision. From there, we will go on to check things like what is the possibility of telescopic prescription to help that person see things in the distance. And then we will move to testing things up close. We will spend a great deal of time doing a plus buildup. We will check magnifiers, both stand magnifiers and handheld magnifiers. So we're going to work with traditional optics to begin with. And from there, we're going to move based on what we know about that person's diagnosis and what lenses and optical devices have we found, traditional optical devices, that will help. We will note those in their individual rehabilitation plan, and we will communicate those to an occupational therapist. Now, we like to partner with occupational therapists, especially those who have a special certification in low vision. Those are tremendous people to work together with. It makes us a great team together. And they will teach a person how to use those devices that we prescribe. From there, I'm going to introduce a person in how to be able to employ different forms of lighting, different filters, and then we're going to go on into electronic magnification. These are devices that use camera technology to help magnify, and it's an awesome thing today. We have many devices that'll magnify anywhere from 1x, which is basically no magnification, on up to 100 times. So no matter what a person really wants to do, we can get pretty much almost any magnification we need to help them. So this is a tremendous opportunity today, and there are different types of desktop models and ARM-based units, handheld electronic magnifiers, portable, that they can take with to their workplace or to school, whatever they may need. We can help them understand that there are all kinds of things available to them. And after that, then we move into smart technology, where they learn how to use things like their smartphones. The vision accessibility features in the Apple devices are the best on the market. The Android devices have many of the similar features in them. So I teach people how to use these devices, their smartphones, their smart tablets, their computers, their TV monitors, and then other smart devices in their home. So there's so many things available today that most people just don't realize that are there that can help them if they employ them properly and they learn how to use the vision accessibility features that may be built in, how to turn those on, and then what are the different ways in which they navigate that device to be able to help them see, to read, or to complete the task that they're trying to do. So that's kind of low vision rehabilitation in a nutshell, and I encourage you, if you know someone that has low vision, please make sure you contact your local low vision provider, and if possible, get them an appointment and get them in there. Here at the E-Center for Low Vision, I work with people over the internet. We don't have a physical office. Our location is on the internet, and that's at echv.org. And the beauty of that is that patients can make an appointment anytime. They don't need to make arrangements for a ride. They can go on and do it themselves, or you can do it for them. And then I encourage people to sit with them so that they learn the things that I teach as well. These appointments and sessions are all at no cost. We just encourage that when people are able to, that they would leave a donation at the E-Center for Hope and Vision to help support our mission of restoring hope and independence. Again, this is Dr. Greg for the E-Center for Hope and Vision. If you like this video, please check that little like button at the bottom. Follow us on Facebook and subscribe to our YouTube channel. And please stay tuned for upcoming episodes on how to use smart devices in low vision rehabilitation. God bless. Look forward to seeing you next time.